Hey guys, Dr. Beto here, physical therapist, and today I want to talk about strokes. Now, a brief overview for strokes is that they're going to either occur due to a hemorrhagic stroke or an ischemic stroke. Now, a hemorrhage, much like an aneurysm, those are the things that can cause those to happen, but it's going to be a bursting in the blood vessel in the brain that's going to lead to cellular death of brain tissue. The other way that a stroke is going to happen is going to be from a blood clot that travels up and enters the brain. There's obviously different arteries and veins in the brain, different circulatory system, and depending on where that blood clot gets stuck, that part of the brain is going to lose blood flow, lose oxygen, and there's going to be cellular death. Obviously, I think a lot of people that are familiar with strokes are going to know that if you have a blood clot on the left side, it's going to affect more the right side of your body, and vice versa. Today, what I really want to talk though, guys, is that if you guys have a loved one that has a stroke, what you guys really should be pushing for when it comes to the hospital, when it comes to outpatient, when it comes to skilled nursing facilities. My wife and I work in a lot of these facilities, and we obviously are patient advocates, but that's not always the case, and sometimes insurances really want to manhandle people and tell you what they will and what they won't do. And what I want to tell you guys to do is that it's serious, and neurologically speaking, the neurological window really starts to close at about 3 months post-stroke. A good representation of this would be, think of cement drying. It's really easy when cement is first laid down to be able to move it around and shape it, to be able to smooth things out, kind of move it where you want to go. But when it starts to harden, obviously it's a lot harder to start doing anything with it. And there's different neurological windows. The biggest one is going to be 0 to 3 months. The neurological window does somewhat stay open for 18 months, but the most gains that anybody's going to get back, 90% of them, are going to be in those first 3 months. So really and realistically, you guys should be pushing everything you have at the patient that's had a stroke or loved one that's had a stroke. Within means, right? But we want to throw, if they don't have any history of cancer or any metal implants or a pacemaker, I'm going to throw E-stim at them. I want to get them up and standing against gravity. If they can't do it on their own, then we're going to assist them with a standing frame. I want them to be able to start sitting at the edge of the bed, start doing postural control training, get a mirror in front of them, start having some of that more neurological involvement. Get them doing things with their left and right hand. Just start working their mind, start working their muscles, and really start throwing a lot of different modalities their way. Because really what's happening is that we're trying to recreate that link. Well, not necessarily recreate it, but we're trying to get all those motor neurons and everything rechanneling down into those muscles. We're trying to get everything back online. There's not just one nerve, right? There's multiple different pathways. There's pathways for heat, for pressure, for light touch, for cold, for proprioception, for motor recruitment. There's a lot of different types of neural pathways we're trying to get back. So it's not just one specific one. And that's why we really want to try to throw lots of different stuff at people that have strokes. So we start challenging them. And what we start to see is we start to see a lot of improvement in those first few months. And then hopefully we start seeing them really get back to their normal level of functioning right around 3 months, and then start working and progressing from there. But I really want to encourage you guys to really push for PT, push for OT, if they need speech therapy. Keep really just going and trying to get more and more, especially for those first 3 months, because the saddest thing that I see is someone that gets stuck within that whole insurance loop for the first month or 2 months, and they finally get on rehab 2 months after their stroke. And we can do a lot in that month period of time, but we're really limited because we should have had them from the very beginning. And we can really see a lot of progress if we get someone on a rehab schedule in those first 3 months. So push for that. And now you guys know, if you guys have any questions when it comes to strokes or anything else, please comment below and I'll definitely get back to you. Have a good evening. Bye.